now I'd like to turn things over to our medical director of the Wisconsin Alzheimer's Disease Research Center and the host of today's program, Dr. Nathaniel Chin. Good morning, Dr. Chin. It's great to see you.
Well, I'll be brief. We want to give as much time for Dr. Souza as possible, but we all know that Jen is truly the host. I appreciate it, Jen, giving me the opportunity to just say hello to everyone. And I really sincerely want to thank all of you for attending today, and for those that end up watching this later, thank you for watching it. We really at our research program, it's part of our mission to make sure that we're communicating with the public, our research participants, interested clinicians, anyone who wants to know more about brain health, cognition, ways that we can just stay healthy, as our program is still looking at diseases and ways that we can intervene on diseases. And so we're really excited for today's speaker. I have the luxury of getting to work with Dr. Souza on a project, which she'll be talking about, I believe, during this presentation. But when we think about ways to keep our brain healthy, we have to look beyond the ones that we tend to think about, which are still important, of exercise, diet, and sleep, and look beyond that to what are other things that can be affecting us, and what are those interventions that really can be protecting our brain, improving our brain. And Dr. Souza is going to talk about that today. And with that, I'd like to thank Dr. Souza or Pam for joining us. I'd like to thank the Aging Disability Resource Centers for hosting this and the Madison Senior Center as well. The greater this network, the more this information gets out there. And so I appreciate everyone's involvement, including our own team at the ADRC that are helping with this, especially you, Jen. All right, and with that, I'll turn it back over.
Thank you. Thank you, Nate. So, Allie, let's go to the next slide. And I just want to take a moment to introduce Allie Randall and Ben Young. Allie and Ben are part of my team. We are the outreach, recruitment, and education core for the Research Center. And so Ben and Allie are amazing at what they do. They help with scheduling visits and helping people get connected to different research opportunities that are going on at the center. And so I just want to recognize them and say thank you for all that you do. And then again, recognize our host site partners, and the slide shows who those all are today. So thank you all. Um, let's go to the next slide, Allie. So without further ado, I'm going to take an opportunity to introduce our guest speaker, who is Dr. Pamela Souza. She's a professor at Northwestern University and chair in Communication Sciences and Disorders with secondary faculty appointments in linguistics and otolaryngology. And I don't know if I said that right, so you can tell me. Head and neck surgery. Dr. Souza's research interests include speech recognition, hearing aids, and the effects of aging and cognitive change on communication. A recurring theme in her scientific work is understanding individual auditory and cognitive abilities in order to customize hearing treatment. Dr. Souza is a fellow of the Acoustical Society of America, the American Speech, Language, Hearing Association, and the Knowles Hearing Center. She is a licensed audiologist with experience in a variety of medical settings, and her clinical interests include hearing aids, severe hearing loss, hearing assistive technology, tinnitus management, and patient education. Dr. Souza's research is funded by the National Institutes on Deafness and Communication Disorders and by the Knowles Hearing Center. Her talk for today is titled Amplify Your Life, Sharpen Your Mind, How Managing Hearing Loss Can Help Your Memory. So welcome, Dr. Souza, and thank you for being with us today. We're so glad to have you. And we are so excited to hear this information that you have for us, how hearing and memory might be connected. So I'm going to turn it over to you.
Thank you so much, Jen. And it is just a pleasure to speak to everyone this morning. I want to thank Dr. Chin and Jen and the Wisconsin ADRC for this invitation, which I appreciate very much. And thank you to all of you who came out this morning into the cold or who are up listening to this. So let me just first check in. How is the sound? Can you hear me clearly where you are? And if people are having difficulty, you could put a note in the chat, perhaps. And while I'm talking, so you can get a sense of whether this is clear enough, if you would like to see a caption at the bottom of the screen of what I'm saying, if you look at the bottom of your Zoom screen, there should be a setting that says CC in a little box, and it should say Show Captions. So if you click on that Show Captions, you will see on your screen a continual feed written out of what I'm saying. And some may find that helpful. So captions are turned on, but you won't see them unless you click on the little Show Captions setting yourself. Okay, let me go ahead and just share my slides. And how's that? I think everyone should see a slide. Okay. So Jen mentioned discussion, and I hope this will be a discussion. Do feel free to put questions in the chat or comments at any time. I can't see those at the same time as I might be able to see them, but Jen is going to watch them for me and jump in
I'll
if
help
there's
you.
anything there. I can see so many things on the screen. Okay, so we are going to talk today about hearing loss, but particularly about the connection between hearing loss and processing and thinking and perception. So let me go ahead here. So I'm, as Jen said, I'm a clinical audiologist. I am also the daughter of a man with significant hearing loss. I am the daughter-in-law of a man with significant hearing loss, in a family with also a lot of memory and cognitive issues. So I've kind of seen this as a scientist, as a clinician, and as a daughter, sister, family member. So in my lab, we are interested in hearing very much, and we're interested in hearing treatment. So what can we do to improve things? We're also interested in what happens up in your brain, because that hearing is not happening in isolation. It's all being processed. And some of the changes that occur with age are having really pretty significant effects on understanding. And then, as we're going to talk later in this talk, there's also the environment in which you are listening. And I saw in the comments for the icebreaker, I saw some great recognition that all of these things matter. How the person is talking, where you are, and how you are listening. So what we'll do today is we'll start just by talking a little bit about the hearing pathway from your ear to your brain. Then we're going to spend some time in that connection between hearing loss, cognitive ability, thinking, and communication, which is such a strong connection. We'll take our little stretch break. And then after the break, we're going to talk more about the practicalities. So what can a hearing aid do to help or not do? And some suggestions to improve communication, not just hearing aids, but other choices as well. And I hope there'll be some good questions and discussion as we go. So let's just start with kind of the basics of how we hear. There are a lot of people with hearing loss. 37 million is the estimate in the United States. And the older we get, the more likely we are to have hearing loss. So by the time we're over 80, at least half have hearing loss that is enough to affect communication. And it's going up all the time, partly because as a population, we're getting older, and so there are more people having hearing difficulty. But one of the tricky things about hearing loss is it kind of creeps up on you, right? I mean, it's not always so obvious at first, or we attribute it to something else. So seeking treatment or evaluation often doesn't happen right away and sometimes doesn't happen for a number of years. So you can imagine that there are a lot of people just kind of dealing with it, not doing much about it, even if they recognize it. And later in the talk, we're going to see how that plays into cognitive ability and memory. Okay, so there are various types of hearing loss. There's what we call conductive hearing loss, which would be a problem that happens either in the outer part of the ear canal, or in the middle ear where the little bones are. And those are physical problems where you might have earwax or an infection that impairs your hearing. But most often with getting older, we're talking about a sensory neural hearing loss. So that's something that occurs, damage to the inner ear and the nerve pathways, the sensory cells. And through our life, there are many things that can cause hearing damage. So exposure to loud noises, certain medications can affect your hearing. A genetic predisposition to have hearing loss if it runs in your family, systemic health issues, circulatory issues being the big one. So diabetes is associated with hearing loss. Blood pressure changes are associated with hearing loss. And sometimes it just happens as we get older for no clear reason. But this is the hearing loss that is present most of the time and the one we'll really focus on today. So what happens when you get hearing loss? Well, it just doesn't sound as clear at first. And it's very common to think at the beginning when that hearing loss is mild that it's not really you. You know, it's the talker just wasn't very clear. They may not be. You can have less awareness of things around you, especially soft sounds, hearing the birds, hearing a clock ticking, those kinds of sounds become very difficult to hear. And what people often notice after hearing loss begins is that they're just tired. You know, you're working much harder to get what that person is saying. So if you notice hearing loss, or if someone in your family notices that you're having trouble hearing, you might go get it tested. So most commonly, when you have your hearing evaluated, you get a check of what you can hear, sounds that vary in level and different pitch. So that's a test with tones. You might repeat words so that the person testing you can evaluate the clarity of words in quiet. They might test speech and noise. That's less commonly done, or other kinds of problems that you're having. So this can give a good picture of exactly what your hearing is like at the time. Now, some of you, I think, have probably had a hearing test done, and you might see something like this, which is the audiogram where we plot hearing. And on this graph, let me get myself a pointer. Okay, so across the top is the pitch of the sound going from low pitch to high pitch, and then down the side is loudness. But what I wanted to point out for you is that in the words that we produce, the vowels tend to be strong, low-pitched sounds. They're really pretty easy to hear. But then there are some consonant sounds that are not such strong sounds. They're softer, fainter, shorter, quicker, and quite a bit more difficult to hear. And when you get hearing loss, it tends to be the consonant sounds that are difficult. But they're also important sounds. So I'm gonna give you an example. Okay, so does anybody know what this word is? And if you think you know what it is, imagine that you heard it spoken. You can put it in the chat. But I think that's probably a very difficult guess. This is like one of the New York Times, fill in kind of games, right? So that's a word that has only vowels. Oh, Jen's smiling. So I think somebody figured it out. But I'm going to give you the consonant version of it. And this one might be a little bit easier. So I think we might see some guesses at what this word is now. Now, if you imagine that you've got hearing loss that affects those high-pitched consonants, you hear something that isn't very clear. And if you got the clarity back and you got the consonants, it would probably be quite a bit easier. So this is a very common experience with hearing loss, is that it's not that you didn't hear it, it just was not very clear. And good for the person who figured out telephone by just looking at the vowels. I think there probably was someone in the chat doing that. Okay, so when you have your hearing tested, you will see the hearing plotted on a chart that is the audiogram chart. And very typically, as we get older, we lose those high-pitched consonant sounds. And then, depending upon how much hearing loss you have, it may be categorized as mild, moderate, or severe. Okay, so everyone is different. And that means that what you hear and how hard you have to work to hear is going to be individualized as well. Okay, so now that we have just a little bit of the basics of hearing alone, I want to talk about this relationship between hearing loss, memory, thinking, processing, and communication, because it's important. Hearing loss is not occurring in this little isolated bubble that doesn't touch anything else. So there's a common saying, which is we hear with our ears, but we listen with our brains. And it is so true, right? Your brain is where you are doing all of the processing and interpretation of those sounds that are coming in through your ears. And really, it's the structures in your brain that is doing the analysis and meaning. If you don't give your brain enough information, it is going to work very hard to try to figure out that missed sound. Okay, so that's what we're going to kind of talk through next. How does this all go together? And then later, what can we do to help? Okay, let me just pause for a minute. Jen, are there any questions in the chat that I should stop and do before we go on and talk about processing?
Right now, I don't see any,
Okay.
but we did have somebody answer
Did
that.
someone got telephone from the vowels?
Yes. I was like, oh my gosh, that's great.
I'm thinking that is also someone really good at that New York Times crossword that I struggle with so much. So
I feel like you might be right.
I think so. Okay. So you may hear the term cognition. So cognition is really all of that thinking and processing that are occurring at the highest level, right, in your brain. And it is a tremendously important component of listening. So as we're talking through how this works, I'd like you to think about a situation where you had trouble hearing. Maybe someplace where you went where you just felt like you were working harder. And even if you don't have hearing loss, everyone has had that experience, right? A noisy restaurant, a talk in an auditorium where there might be a lot of echoes or distracting noises going on. So think about that as we talk about how all of this fits together. So we're going to kind of go through some of the components of cognitive ability, attention, memory, reasoning, right? So let's talk about attention first. You're giving me your attention this morning, and I appreciate it very much. But there are lots of different kinds of attention that are involved in listening. So we have selective attention, which is focusing your attention and trying to ignore the distractions. We have sustained attention. If something's going on for a while, you have to use your attention to maintain focus on whatever that is. There is alternating attention. So if there's more than one thing going on, and I'm thinking of Dr. Chin's example of children and wife and switching back and forth, attending to both of those streams of information. And then there's also kind of divided attention where sometimes we have to process more than one thing at a time. You're having a conversation, but you're listening for the oven timer to go off at the same time. Okay, so those are all ways in which you're really using that cognitive energy and attention as part of your communication. So then after attending to it, now you got memory involved, right? Because when we are listening to someone talk, it passes by. I've said a word and now it's gone. What you are using to understand the sentence is retaining those earlier spoken words in memory. And just like attention, there are different kinds of memory. So we will spend some time thinking about working memory. So working memory is that memory that you're using to process in the moment, right? Taking in information and holding on to it for long enough that it's meaningful to you. We also have short-term memory, which is something that happened just recently, and long-term memory, remembering events and facts. And then we can also have perspective memory, where you're knowing about something that you are going to do in the future, a doctor's appointment tomorrow, or something like that. So in audiology, and especially those of us who think a lot about how the ear and the brain work together, we pay a lot of attention to your working memory, because you can think of that as a temporary storage system. It's taking in information, it's holding on to that information, and then it's using the information. And if you didn't have working memory, you wouldn't understand what anyone said, because we need to hear that auditory information. But it also has a big effect on speech recognition. So as someone talks, you take in all those bits of acoustic information and you're actually matching it to a stored representation in your language memory. That's how we know what the words were. If it's an easy situation, so the room is quiet, the speaker is clear and not speaking too quickly or mumbling, there's no distractions, you can match that information very quickly. And so listening is easy, right? You know what I'm saying here. But what if we make it more difficult? And what if we degrade the sound that's coming in? So a common degradation would be background noise, right? Now what is coming in is no longer clear. You're having to listen to mixed speech and noise, and you're trying to match those bits of information to stored representations. This is where people start to get tired and start to fall behind in the conversation, because your brain is kind of going, wait, what was that word? Oh, wait, no, it couldn't be that. It must have been. And while that match is happening, the conversation has rolled on, right? So now you've missed the next thing that came along. So what we know is that when people have lower working memory, and that can happen as we get older, it's not so much hearing as processing that is now involved, because you don't have lots of extra resources to sort out that difficult, degraded, noisy signal. And if you've got hearing loss, some of it is also missing for that reason. So when we talk about the connection between good hearing and cognitive ability, and then what we can do about it, I want you to think about this part, that it's those memory resources, those working memory resources particularly, that allow us to compensate for the missed information in what we hear. And if we can get more information in what we hear, then there's less burden on our working memory. Okay, so now let's switch to the next really important cognitive ability that interacts with listening, and it's our executive function. So the executive function is the executive sitting up in your brain, deciding where to allocate your attention, how to inhibit things that are less relevant, how to coordinate the task, how to switch between tasks. Okay, so this is not just attention, but it's actually directing. I imagine, some hopefully very capable executive in my brain who's saying, listen to this. No, now switch over here and do this. So this is another level of cognitive processing that is very involved in listening. And it's part of why listening in noise is so difficult. Okay. Because if you have lower executive function, even if your hearing is good, it's going to be much harder to extract information from that very complicated, noisy signal. I like this picture because this is kind of the nightmare scenario for hearing loss, right? This is a restaurant where you're trying to have a conversation at your table with the people that you have come to dinner with, and there's just noise and distraction everywhere. Other people at other tables, other noises in other places. You can see the open kitchen back there. But then the waiter comes over, and now there's a switch. They're talking from behind you to ask you a question. So think of all the work that your brain is doing in a scenario like this. You're trying to focus on a talker in background noise. You're signal might have a lot of noise or echo reverberation in it. You're processing multiple things. You're switching between different talkers at your table. And at the same time, you've got things that you're looking at. So several people in the icebreaker mentioned using visual cues to help in difficult scenarios, but your brain has to take in what you're seeing, what you're hearing, and put it all together. So listening anywhere requires hearing and cognition, but particularly difficult listening, where the burden starts to shift to how much your brain, your memory, the speed at which you can process is going to help you compensate for what is hard to hear. And it is a lot of work. Okay, so if you have hearing loss or you have just been during the day in a situation where it's difficult to hear easily, you're very often aware of it, right? You are tired. You're aware that you may be putting more effort into it, and that effort is all cognitive effort from your brain, right? Straining to hear. But what you're really doing is straining to process, straining to extract information, straining to remember information. So this is where we really start to see that there is a strong, strong connection between hearing and memory, because everything that we hear processes up through those finite cognitive resources of our brain. Okay. And the more effort you're putting into listening, the less you have left for learning, thinking, responding, right? So we know from research studies that when you put someone in a situation where listening is very difficult and you ask them to do something else at the same time, like monitor a picture or something like that, their ability to do that other thing just drops in half because so much of their cognitive energy, their memory, and their processing is going into just trying to listen and put together what they hear. And if you are putting a lot of effort into listening, you don't have a lot left to store information for later. So in other studies, we know that if you have hearing loss and listening is very difficult or effortful, you can't remember what was said later because you needed memory capacity to store that information and you didn't have it. It was getting used up for this very effortful listening. All right. Jen, I'm just going to do another quick check, and if you don't mind, and just let me know if there's anything coming in on the chat, we might want to stop and
Yeah, we have a question that just came through actually. And isn't this why multitasking is a myth?
oh, multitasking, the myth that we can all do it and it doesn't cost us anything. Yeah, myth, right? Because we unfortunately do not have unlimited brain capacity to add in, add in, add in, add in. Yeah, so you're probably taking it from somewhere else. I do know people who claim that they can multitask at no cost to themselves, and I don't think I believe it. There's some finite capacity in the end when you overload. Yeah.
I want to echo Dr. Souza there too. Dr. Steve Barzy, who's the fellowship was the fellowship director at UW for geriatrics, and he's been a geriatrician for over 30 years. And he always taught us there's no such thing as true multitasking where you can give 100% to two or more tasks. That we should think about it as it's 100% focus, and you simply get to divide it however you choose. So 50% to this and 50% to that. But in essence, you're not giving your all to either of those tasks, and you're not going to be as good as 100% to one. And so I agree with Pam. I don't know if it's there are people who claim they can do 100%, but I don't think they're right.
Yeah, so true. And you could imagine that if you are multitasking on two very small tasks, two very low effort tasks, or maybe one is a very learned practice task and the other one's easy too. I think that's when people say, "Oh, I'm good at multitasking." But everyone's got a breaking point, right? At some point, you have overloaded your system, and the cost may not be immediately apparent. So this point that it's later when you can't remember what was said, you think you're multitasking fine, but in fact, you just don't have the same resources available. So we're going to come back to this idea when we talk about hearing again. So what can we do to support our hearing, which will then support our brains, our memories, and our processing. Okay, so I want to go through just a little bit of the background science where we know that hearing loss and cognitive ability are closely tied together. But why is that? Exactly what is the connection? So one of the things that scientists have found is that people who have changes both in their cognitive ability and in their hearing might have a common something, right? So genetics, vascular problems. This is why I know there's been some talks in this series on really taking care of your body, right? Diet, exercise, reducing stress, because it's really all connected. But the other thing that happens when you have hearing loss is sometimes you go out less, right? Because it's harder to hear, or it's harder to hear in certain situations and group situations. And we know that being engaged in our lives in some way, whatever way is right for you, is good for your brain, right? It's protective of your brain. So there is a second point where there's worry about having so much hearing loss that people then start to avoid all social situations because being isolated in that way is not the best thing for our brains and our cognitive ability. We want to go out and engage in the world. The third connection idea is really the one we've been talking about with processing, which is that when listening gets more difficult because there's noise or because there's hearing loss, you have to compensate. And the way you compensate is by devoting more of your brain, more of your cognitive resources, which then leaves fewer of those available for something else. Okay, so that ear-brain connection is really close. Now, because of all this, there was a report in 2017 that got a lot of attention. And this was not a single study, but it was a review of many scientific studies. And the question was, what are the things that might increase your risk for dementia or cognitive change? And they went through many, many, many different factors, some of which we can't change. Right. My family has a strong genetic history of Alzheimer's, and there is nothing I can do about that because I got the genes that I got, and that's it. But there are many things, many choices that I can make in my life and my health that will, reduce my risk. So one of the things that this study said was that hearing loss actually contributes a substantial percentage of the risk to dementia, and it's modifiable, right? We can do something about our hearing loss. So it's in this little bubble along with high blood pressure, obesity, and then later in life, we see smoking, depression, physical inactivity. I mean, these are all things that we can change. And I think these have been some themes throughout this series is, we can't control our genetics, and we can't control some of those things that passed early in life, but we can control the choices we make now with our health. One of those being how you manage your hearing loss. Okay, so now there's the big question. Should you treat your hearing loss? Should you do something about it? And if you did, would that in some way have a better ability to maintain your cognition, your memory, your thinking? And spoiler alert is we think the answer is yes from the research, that yes, treating hearing loss does seem to be protective of your memory, of your cognitive change. So there's lots and lots and lots of studies on this, but I like this one because it was such a large study and it went on for so long. So this was a study in France, and they enrolled 36 600, 3670 adults, and they followed those adults for 25 years. And over that 25-year period, they gathered information. And what they found is that the people who said they had hearing loss tended to have poorer cognitive ability, poorer memory, poorer processing later in life. And this is not about Alzheimer's. This is just about maintaining our cognitive ability and thinking. So the people who said they had hearing loss were also scoring lower on tests of their memory and thinking. But the ones who wore hearing aids for that hearing loss looked like the ones who had normal hearing. So this is some evidence that treating hearing loss can preserve cognitive ability, but it's indirect, right? Because we are letting people do what they want to do. You want to get a hearing aid, go ahead. You don't want a hearing aid, that's okay. And the worry about this kind of research is that there is a certain self-selection. You might choose to take better care of your health, and so you might be more likely to get a hearing aid, but maybe you're also taking your blood pressure medication and doing regular exercise, right? The study didn't account for those kind of personal choices. So just last year, we got results from a study that tried to measure more directly whether hearing aids would be helpful. And this is a study out of Johns Hopkins in Baltimore. It got a lot of attention, and I think we'll continue to get it because it was a very well done study. And it was what we call a randomized trial. So randomized trial means instead of letting people choose what they want, you put them into groups. And in this case, one group of adults with hearing loss were given hearing aids, and the other randomly selected group did not get hearing aids, but they got an intervention that didn't have to do with hearing. So they just got a healthy aging educational series of information. And the researchers followed them for 3 years. So the big question is going to be, are the ones who got the hearing aids for their hearing loss better off in their cognitive ability and memory than the ones who didn't get the hearing aids? That's what we want to know. Okay, so on this slide, so we've got recruitment of the participants, and this is going to be the important thing to the results. So they took 2 groups of people. They took a group of people who were already in a study because they had high cardiovascular risk. So they had high blood pressure or other cardiac issues. And so they were enrolled in this research study for that reason. So 238 of the people in this heart health study came into the hearing aid study. The other group, 739 of them, were people who were new volunteers from the community. And those were people who were generally a little bit younger, a little bit healthier, and much less cardiac vascular problems. So then they end up with almost 1,000 people. They give half of them the hearing aids, and they give the other half this healthy education treatment, and then they follow them for 3 years and see what happens. And for the group as a whole, did hearing aids have a positive effect on cognition? For the group as a whole, they said no, didn't make a difference. Okay, so that's pretty disappointing. But for this group that was at greater risk health-wise because they had more cardiac problems, the answer was yes. Giving them hearing aids allowed them to have better thinking and memory function at the end of the study. Okay, so it's kind of a yes, but. Do hearing aids help with cognition and memory and thinking? Yes, but. Yes, but mostly for the people who were at greater risk for cognitive decline already. You know, I do want to say this was 3 years, and 3 years is a blip in the time course of our memory and health as we age. So they're still following these folks to see what happens, and we might get more information. But we know that over a relatively short time, 3-year period, getting hearing aids for hearing loss did not change the cognitive ability or did not slow the decline of cognition for everyone, but it did for people who were at greater risk to begin with, health-wise. Okay, so now what do we know about hearing aids and cognitive impairment? Um, we, it appears that hearing aids are helpful, but some of the results are from these studies where people chose for themselves whether or not to get hearing aids. So we want a higher level of scientific evidence by randomly assigning people to get hearing aids or not. And in this one really good trial over a 3-year period, we did see that treating hearing loss with hearing aids can slow cognitive decline for people who are at greater risk, which in that case was people with more cardiac and vascular issues. Okay, so that's kind of where we are. It's not all of the answers that we would like to have, but it does start to give us some information along with these ideas about hearing loss putting more strain on your brain and memory, about what we might want to do on an individual basis. Okay, let me look at time. Okay, so we are about at the halfway point, and this would be a good time for questions and discussions, Jen, if we have a little time before the stretch break.
Yes, yes, we do. We do have a question in the chat. If you are worried about remembering what somebody says, does that affect your ability to remember what they say?
Oh yeah,
So it's more of a anxiety question, but
right. Right. So I might ask Dr. Chin to chime in here, but worry is also something that takes up cognitive resources, right? So if you are allocating some of that stress, worry, anxiety, and if there's enough of your attention focus attributed to stress, anxiety, worry, there might be less to process that incoming auditory information. Dr. Chin, you want to jump in
Yeah,
here?
I completely agree. And I come back to this idea that our mental energy at the beginning of the day is sort of fixed. And that's why, towards the end of the day, sometimes we don't feel as sharp, and it's because we've used it. And there's good studies to show that willpower itself has a fixed
Mm.
amount. We could regenerate it with a good night's sleep or a nap in the middle of the day. And so the same thing when it comes to worry. And I think, Dr. Souza really did emphasize if the worry is bothersome enough that's actually occupying your attention, that is taking away some of that mental energy, and it's harder to then focus on what you're hearing. And so I think one of the amazing things about human beings is we have the ability to think about thinking, but one of the downsides is that we can worry about thinking, and that then impacts our thinking. And so that, I mean, it speaks to the importance of mental health for sure. There is a really great question for you, Dr. Souza, about tinnitus, because that is really bothersome. I have tinnitus, and when I recognize it, man, does that occupy my attention? Can that impact a person's brain strain in a similar fashion?
Sure. And I think tinnitus might do two things that could act as a brain strain. One is just if it's stressful, which it often is, for tinnitus, you're aggravated, you're anxious, your attention's on your tinnitus. It's kind of in this category where we're talking about enough attention or worry that distracts you from being able to process whatever else you're listening to. Yeah, absolutely. And we should say also about the scenario, it might also depend on how easy the listening is to start with. Right. Because if it's a nice quiet room and a clear speaker well, there's probably less worry about that, but there's also less distortion of the sound. So you're not needing as many cognitive resources to compensate in that case. And a little worry might not matter. But if you go to a restaurant where it's really hard to hear and now you're stressed, or you're giving a talk to 100 people, let's say, and you're worried you might not hear what they say, it's going to be harder. So yeah. The other thing about tinnitus too is that it literally makes it hard to hear, right? It's blocking some of the information that is incoming. We don't it's not a tinnitus talk, but I will say there's lots of treatments for tinnitus and evaluations too. So if I'll be around afterwards if anyone wants to talk about tinnitus. Okay, I see another great question, which is, do you recommend a baseline assessment of hearing at a younger age as opposed to waiting until there are problems? That's the first question. I do, because then you know where you are. And one of the things about hearing loss is it's so subtle and sneaky at the beginning. You might think your hearing is fine, but possibly not. So if you get a baseline assessment, you have something to compare to later. So if you notice a change, there are some previous results to see how big that change was, but it also tells you where you are. Um, I was always bothered as I got to the age where I knew hearing loss could occur that my primary care doctor, who I really like, would look in my ears every single time, but she never asked me a single question about whether I was having any difficulty hearing. Why are you not asking me? I statistically might have hearing loss. So yeah, I'm a fan of earlier assessment. Medicare will cover hearing evaluations, by the way, if your physician orders them. So then it would be free to you. And there are lots of ways to get that. So it's not necessarily something that would cost money. And then the other question there is there any connection to vertigo, to dizziness and hearing loss? That system internally is all connected. The balance system and the hearing system are physically connected, and they share internal fluids that have a particular chemical balance to them. So yeah, sometimes if something goes wrong with hearing, it can go wrong with balance or vice versa. So. And then adding to that, what would be a good age to get a baseline test? So certainly if you notice changes, you should get tested, but we know statistically hearing starts to change usually in kind of our 40s to 50s. So I would say that's a good, sort of midlife range is a good point to get a baseline test. Or if you didn't, now is also good for anyone older than that. Oh, okay. Good. So, can the air pressure from use of a CPAP lead to some hearing loss? By the numbers, it shouldn't, right? Because even though it sounds loud and it's close to you, it's not physically that loud a sound. But I don't know that there has been any good research on that, to be sure. But yeah, obviously a lot of people are hearing that continually through the night. Yeah. And these are such good questions. Can TMJ, so temporal mandibular joint, that's this joint where your jaw attaches to your skull, can that be associated with hearing loss? Not usually hearing loss, but it can definitely cause tinnitus. So if you have problems with that particular joint and you've got ringing in your ears, then maybe talking to your provider about whether that might be contributing.
So as we get back into our part two, Dr. Souza, we do have a question in the chat about if someone has been wearing a hearing aid since 6 years old, is it possible that there has been a decrease in executive functioning versus when someone experiences hearing loss at 70?
Yeah, let me just check that my volume is okay. Everyone hearing me clearly again? Okay. And just as a reminder for anyone who joined late, if you would like captions at the bottom that are live captioning to my voice, there's a little button on the bottom of your Zoom screen. You should see it says CC in a box. And if you click on show captions, you'll get a live feed. Okay, so hearing loss early and hearing aid early versus late. So these are really different situations. And the 6-year-old in this example started having hearing loss and wearing a hearing aid at a very young age when your brain is very plastic, right, to develop differently. And what happens there is sometimes your brain rewires in a really positive way. You're, growing up using different auditory cues. So what we find with children who have hearing loss from birth or very young and who have that hearing loss treated very young is that they don't get the same category of detrimental effects that we do when hearing loss comes upon us later in life. I don't know that there is a specific answer to the executive functioning question, but often what we see is that people with lifelong hearing loss are very well adjusted to that hearing loss and have lots of good strategies to communicate. And they're almost in a more positive situation than when you've listened with normal hearing your whole life and now suddenly are adjusting at 70 or 75. So, and then there was a good question. What should I look for in selecting an audiologist to schedule a hearing exam? So it's often nice to just start with your primary care physician. Sometimes they have audiologists in their network, within their practice, and that also can help if you're using insurance to pay for the hearing test, or if you're having it supported by Medicare, then it has to start through your physician. If you were just going out to find someone to give a hearing test, there are lots and lots of audiologists out there, and the American Speech and Hearing Association has a, kind of service finder site. I'll put it in the chat in a couple of minutes. So you can go there and you can put in your zip code and you will see licensed, qualified audiologists who are close to you. So that's sort of an easy way to start out if you're not going through recommendations from your physician. Okay.
Pam, one quick question for you. What about the hearing tests that you can have sort of at like Costco or these other big centers? That's not the same, right, as going to the audiologist at the healthcare place? Like what do you say to your patients when they're asking questions about those particular options?
Yeah, it depends. So the big box stores like Costco, some of those stores hire audiologists, but it's not always easy to tell because it depends on the state and the location, and you might, unless you ask questions about that person's qualifications, you might not know. But that is a perfectly fine place to start with a hearing test. One thing I want to mention is that in the US, we are entitled to copies of our medical test results, including our hearing test. And so I just say that because sometimes you want to get the hearing test at one place and then pursue further care at another place. And I think sometimes there's the implication that you can't do that. But in fact, you can get a copy and you can take it to your doctor, have it sent to your doctor, take it with you. That is useful to do. All right, shall we go ahead to
Yep,
part
I
two?
think we're ready.
Okay.
Yeah.
So now we're going to switch a little bit from, oops, that's not how I share. Let me fix that. During the break, I forgot how to share slides. Let's see. There we go. Now you should see the slides. Okay, so here's where we stopped. All right, so we're going to switch a little bit from kind of the science and the connection of hearing and cognition, and now talk a little bit more practically about solutions. Starting with hearing aids, but those aren't the only solution. So we'll also talk about ways to improve communication. And I want to come back to some of those great points that people made in the icebreaker of what they have found to be helpful or to use when they have difficulty hearing. Okay, so we know that hearing loss affects a lot of us as we get older, up to half of adults as we get over 75 or 80. But it's often not treated or even evaluated. So statistically, there are a lot of people who could hear better with hearing aids, but less than a third of them have ever used them. And that number also includes people who tried them but didn't keep them or wore them for a while and then stopped. So a lot of untreated, unmanaged hearing loss out there. We do know that hearing aids, properly fit hearing aids, are very successful. They can certainly improve communication. They don't fix the hearing loss, that, your hearing loss is still there, but they amplify sound in a way that can compensate. So I think some of this might be familiar, but just to show what I mean by hearing aids, these are pictures of different types of hearing aids, and I'm going to get my pointer back here. There. Okay. So this is very common, this kind called a receiver in the ear. And what happens is the sound is being output through this little tiny receiver that sits at the tip of the hearing aid. And that allows the whole hearing aid to be quite a bit smaller than it would otherwise be. So if you're going to get a behind the ear hearing aid these days, it's probably this little type. There's also more for severe hearing loss, a slightly larger behind the ear hearing aid where the microphone and receiver are in here, and then it just puts the sound out through this custom ear tip. And then we have various sizes of hearing aids that are smaller and that fit entirely inside the ear. It's really less about the external style and more about what it's going to do for you with the sound. So we can go deeper into this for people who are interested, but I wanted to briefly say that modern hearing aids is like a computer in a box, right? It's processing sound digitally, and it's doing a lot of things that are attempting to make that sound not just louder, but clearer. For example, a directional microphone means that the hearing is trying to focus more on the voice that you're trying to hear and somewhat reduce the background noise. They do a lot of automatic adjustment, and the newer ones are using artificial intelligence to try to do that adjustment, right? To learn from the environment and focus where it should be. They do try to digitally reduce the noise, and then hearing aids now very often will connect to other devices wirelessly. So streaming from your cell phone. I think we've all experienced that hearing out of a cell phone is not the easiest thing that we can do. And if you have hearing loss, it's quite difficult. So connecting wirelessly to other devices. So if someone wanted a hearing aid, there's no one size fits all. And so this should really be a conversation with whoever you're getting the hearing aid from about what you need. How are you spending your time? What are the things you're having difficulty hearing? Is that a one-on-one conversation or is it in a group setting? And then your preferences for style. So I often talk to patients who ended up buying a particular hearing aid and they really have no idea why that one was recommended for them. And that makes me sad because there's so many choices. You really need professional help to make that match, to get what you need, to get what is right for you, not just what it looks like on the outside, but how it processes sound. So part of that is choosing, an audiologist that is really a partner with you in suiting the treatment to your needs. Now, I will say, even though, I believe in hearing aids and I believe that they are tremendously helpful, but they don't always make things perfectly clear. And it's partly because that hearing aid amplifies the sound in the room, but it's putting it into your ear and brain. And sometimes when you have hearing loss, there is quite a bit of damage that has occurred, and that damage is what's receiving the hearing aid amplified sound. Okay, so sometimes even with the best set of hearing aids, the clearest, most advanced processing, people will say, I still can't hear that very well. It's not as clear as I wanted, right? It's not as easy as I hoped to listen. And sometimes then we need to think about other solutions that are not just the hearing aid, but are solutions that target the environment that you're listening in, the person you're trying to listen to, and the way that you hear. So that's kind of where we're going to take this conversation next. Okay. So remember earlier in the talk, I put up that picture of a restaurant and I said, this is the nightmare scenario for hearing loss. It's crowded, it's noisy, there's a lot going on. someone with a hearing loss who puts that hearing aid on in that restaurant is not going to be very happy, probably, because the hearing aid is picking up whatever there is in the room, and that includes the noise, the dishes clattering, the people at the other table. So I am a fan of using a remote microphone, and I put this kind of silly picture in here. This is obviously not what a modern remote microphone would look like, but the principle is the same, right? When the person you're trying to hear is in noise or they're at a distance, if you can put a microphone close to them, close to the source of the sound and transmit it to your ear, it is really tremendously helpful. So there are lots of systems like this, some that work with hearing aids, some that don't require hearing aids. And the trick is really that you put the microphone near the sound. So sometimes people say, oh, it's like an extra ear, right? It's like putting your ear close to the talker. So here on this slide, we talk about the 3 C's: catch the sound, carry the sound to your ears over a distance, and then put it into your ear directly. And these are good for noisy situations. They're good for distant situations where maybe the speaker is on a podium, or you're in a church or temple where the speaker is further away. And I have also often recommended them in the car because cars are terrible places to hear. They're noisy. One person is driving and presumably looking at the road, and so you're not even looking at each other. So they can be of use in all of those situations. And this is not just a hearing aid, but a different kind of assistive device. Okay, so now we're going to talk a little bit about over-the-counter hearing aids, because over-the-counter hearing aids is something some of you may be hearing about or thinking about. And so this is new because it used to be that the only way to get a hearing aid was to work through this rather laborious, time-intensive, sometimes quite expensive process where you got the hearing aid from an audiologist or hearing aid dealer. But since 2022, we have been able to purchase over-the-counter hearing aids. So this is new legislation. Same technology as conventional hearing aids, but available to you over the counter, by mail, online. The CVS and Walgreens close to me both are selling over the counter hearing aids. No prescription needed, no clinician visit, and ideally would allow you some control over the sound. Here's one of the things. It is only for mild to moderate hearing loss. These are not approved for severe loss. They are not approved for children. So it's, a sort of a narrow set of patients. So for over-the-counter hearing aids, I've divided them into 2 categories. One which I called preset. So that's the sort of out-of-the-box solution. It might have a button to change programs for maybe louder, softer, a little bit of noise reduction, but it isn't programmed or customized for you. It's just, a generic kind of one-size-fits-all, but very simple solution. The other category, which tend to be more expensive, are these self-fitting options where what they usually ask you to do is connect it to a smartphone and make some adjustments on the smartphone to make the sound better for your loss. Sometimes there's sort of a hearing test in it. Sometimes it's just sound quality, what sounds better to you. But there can be quite a bit of price difference between the two. I would say the preset OTC hearing aids are kind of more in the hundreds category, and then some of the fancier self-fitting one, we're talking more in the thousands, 2,000. So it's not quite as inexpensive as we might hope, but they're available. And this is just, some of the ones that are currently out there, so you can see what they look like. But here's some preset ones. Comes out of the box. It's got an ear tip that hopefully fits in your ear, but again, it's not customized. And then this one happens to have a volume switch and a button. And then they might either be a sort of in the ear style, or they might be a behind the ear. But you don't need to see an audiologist or hearing aid dealer. You can order them or pick them up at your local Walmart or Walgreens, and they do provide some amplification. So let me do one more thing and then I'll stop and we'll just see if there are questions or discussion. So I'm just going to say that Dr. Chin and I are part of a research team that is asking this question about over-the-counter hearing aids. Do they help in cases where you also have either mild cognitive impairment or some early dementia, right? Because there's been much less attention to that group, and we've already talked about how strong that ear to brain connection is. It's appealing to get an over-the-counter hearing aid. It's easy to get one, but would it be helpful in those cases? So we do have a research study where we are asking that question, giving over-the-counter hearing aids to people enrolled in the study who do have either mild cognitive impairment or early dementia and a hearing loss. And we're hoping to find out just how helpful they are and for who. So that study is enrolling in the Madison area, in the Chicago area, and in La Crosse, but it's based at Mayo Clinic there. So it would be for Mayo Clinic patients in the La Crosse area. So anyway, we would be happy to provide more information. We don't have all of the answers yet, but what we're hoping is that over-the-counter hearing aids are a positive and helpful solution because we really want to relieve the stress that hearing difficulty is putting on your brain. And we recognize not everyone can just run out and buy, a set of hearing aids for lots of reasons. So, okay, so let me stop there for just a minute. And I don't see chat now, but I can look at it. Questions in the chat about over-the-counter hearing aids or hearing aids in general?
Yeah, there is a question. What is the difference between the types of hearing aids that you've shared and cochlear implants?
Oh, yes, good question. So a cochlear implant is a surgical option in which a wire is implanted into the inner ear. And the way a cochlear implant works is that sound comes in from the outside and then it's transmitted as electrical pulses into the hearing nerves. Okay, so a cochlear implant is not an aid to hearing. It is a hearing solution for people who have no usable hearing. Usually people who have tried hearing aids and hearing aids are not enough, because their hearing is so severe. But it does require surgery. And there is a process of evaluation, just in case there's anyone in this category in this group. You could ask your physician or your audiologist, is it appropriate for you to have an evaluation to see if you are a cochlear implant candidate? And it's a series of tests. And basically the question is, are you in the category where hearing aids could not help? Your hearing is so severe that they're not enough or you're not getting benefit. And then the implant may be a choice. So, yeah, I should say too that implant hearing is not like regular hearing. People have to sort of relearn hearing in a slightly different way, but they can be tremendously beneficial for people who can't use a hearing aid as the solution to their severe or profound hearing loss.
And then there's one follow-up to that question about, is there any difference with the size of the implant?
Oh, on the outside of the ear? So the implant is entirely within the skull, and there's usually a device that is usually magnetically connected that sits back behind the ear. And I'll see if I can find a picture that maybe I could put up later in the talk. But yeah, they look physically different, the implant versus the hearing aid. With the implant, the sound is coming through the electrodes in the device. It's not going down the ear canal anymore. So yeah, quite a different setup.
I think that's it
Okay.
for the questions for now.
It looks like Kelsey has her hand up. I don't know if there's also a question in the chat.
Kelsey, is there some additional?
Yes, we have a question that we want to ask.
Yeah, actually, it was just a comment. You might
be getting to this later, but if people are still working and are employed, the vocational rehabilitation program within the Department of Workforce Development will cover the cost of hearing aids if you can demonstrate that hearing loss impacts your ability to do your job. And
Yes.
so it's very easy to work with, and they cover all the costs, and there's no income requirement or anything. So I did that myself after having ear surgery a couple of times, and so it's something to put out there for people.
Yep, absolutely. Thank you so much for that comment, because most people don't know that.
Right.
That if you're still working, you can get free hearing aids, if you meet certain criteria, and they're not income criteria. The idea is to help you keep working. Okay, so let's go on to the fourth and sort of the last section here, which is hearing aids aside, how can we improve communication? And I think that many of you have figured this out or figured out some things that help you, because I've heard so many great suggestions at the beginning of the talk. So people talking about using nonverbal visual cues, reading lips, using gestures, controlling the environment by turning down the noise, turning down radios, reducing background noise. In Dr. Chin's case, I guess moving your children to a different room so that you can converse with your wife. We have that happen here too. And one thing I really appreciated were the suggestions to educate the talker. Tell them you are not hearing them, right? Tell them what will help you, moving closer or writing down. So we're going to go through some of these. So this is the way I like to think of it. Communication is not just us listening and hearing or not hearing, right? Communication involves the talker. The talker has a big role, the space in which we are listening, the environment, and the listener. So when we start to think about solutions that will make hearing easier, and in making hearing easier, reduce that burden on your processing, on your brain, we don't just think about us as a passive listener, we think about the source and the environment. So there are lots of issues with talkers' voices that play into this. So how loud they're speaking, and this is not to say that they should shout, that's not helpful, but the voice intensity, and if they are far away from you in the other room, talking with the water running. My husband always calls me on this when I'm trying to tell him to do something from a different room. He's like, I can't hear you when you talk from that room, right? Because you're too far away. Their ability to project their voice. Sometimes people start to have vocal problems where projecting is difficult. Their voice is hoarse or soft. How fast you talk, how clearly you speak, and the right, like that's not good, talking into your hand or with an object at your mouth. So the talker can help make it easier by doing the good things, right? Face-to-face, clear, slow communication. Now, the listening environment is also at fault, especially if people are at a distance. And so in this picture, what is being shown here is that it's not just that the sound has to carry, across from the talker to the listener, but it's also bouncing off all the hard surfaces. And that is very distorting. And the further away the talker and the listener get, the more these reflections off of surfaces happen to interfere. I often go out to eat with a friend who he wears hearing aids, and he is a retired engineer. He actually lives in Milwaukee. And because he's a retired engineer, he thinks about things like acoustics and processing. And so we'll walk into a restaurant together and he'll say, no, we can't sit there because look at that big plate glass window. That's going to be too reflective with his hearing aids on. I think he's not the average diner at a restaurant with hearing aids on, but he does think about the environment, and the environment matters. Now, also in the environment, we may have hearing loss and using hearing aids or assistive devices. So these are all part of our compensation when you've got those big, echoey, noisy rooms. All right, so for the talker, in this room, I think we have people who converse with other people who have hearing loss, remember we said attention is so important. So if you can get attention first, reducing the background noise, slowing down, looking at the listener, projecting clearly, like these seem like such kind of low level common sense things, but as habits, they really can make a huge difference. And I know in families and at home, we often get into bad habits. In my house, I'm always doing 5 things at once and chasing children and washing dishes, but it's not the right thing to just talk with my back to my husband and expect that he is going to be able to focus on what I'm saying. I should turn around, get his attention, reduce the background noise if possible, and then we have a much better conversation. So in the space, anytime you can reduce the background noise is good. And in a couple of slides, I want to talk about restaurants and then medical care, hospital situations. Like those are often very difficult communication situations and what we can do. But generally, seeing the speaker, being closer to them, and being in less reverberant large space is helpful. Okay, so for the listener, and I heard that some of you are already doing these things, you're looking at the talker, right? You're choosing to position yourself so that you can see, and you're saying that you have difficulty hearing or asking for clarification if needed. People don't know, and often if they know that you're having trouble, they will do the right things, to help you out. I just wanted to make a point that in a public space, that there are actually federal regulations about allowing people to listen. So there are often assistive systems in churches, in synagogues, movie theaters, auditoriums. Sometimes you just have to ask to get those. I think every movie theater around here has assistive devices at the box office. So when you check in, you can pick one up and you can hear the movie through your own headset. Okay, so I have a few slides here that are, I'm just keeping an eye on the time, that are just about kind of strategies. And we'll just go through these quickly, but we sort of think about anticipating what you're going to talk about. So methods to prepare for communicating. Just to use another example, I know if we're going to a work party or something for me, my husband will in advance have me tell him the names, who's going to be there, what are their names, because he can't get the names in the course of the conversation. So he's anticipating the information that might make it easier for him to be in that crowd having a conversation. This was a big one that people talked about during the icebreaker, is just give a little instruction. Let people know that you are not hearing them and tell them what would be helpful to you. Sometimes it's speaking up louder, but not always. It could be slowing down. It could be stepping to a different part of the room that is a quieter part of the room, and they're not going to know unless you tell them. So repair strategies, I think we all do this, but it's asking for clarification. And one of the things that we teach family members in some of the classes that we have here is you don't just repeat the same thing over and over if someone missed it, right? You can repeat it once, but sometimes repeating is not helpful. And so then we have summarizing and clarifying. So it also can help to say, let's talk about what we're going to do on vacation, like give a heads up that the topic is changing. Lots of simple little things that make it easier. And then someone asked earlier, if you're stressed about not hearing, is it making the whole thing worse? Yeah, it could be. So you can't always hear everything all of the time. No one hears everything all of the time, and it's okay. We just want to make what improvements we can. Okay, so the last little bit I have here is just to think about what are some of the particularly difficult scenarios, and one of them for sure is restaurants. It's a loud place, and some of them really they want it loud. They like the vibe of the noise in the restaurant. So what can you do? I always ask for a quiet table. And I have sometimes been surprised by having them take us into a room where no one else is sitting and give us a table in that quiet room. I mean, I love that because it is quiet. But if they can, they will accommodate you. And it is definitely worth asking. And I don't just say, can I have a quiet table? I say, we have someone here who is having trouble hearing. Could we have a quiet table away from the noise? They do, away from the kitchen, away from the bar. I always choose a high-backed booth because then you have this kind of little padded, semi-room around you that is much better than sitting at a table in the mass of all of this noise. And then depending on whether you're wearing hearing aids or not, you may have a hearing aid that has some directionality to it. So what you want to do is kind of get your back to the noise so that the hearing aid has a chance of making that separation for you. Not a bad idea to aim for quieter restaurants at less busy times too, if you can. Okay, so now here's a situation where everything sort of comes together, right? It's stressful, it's anxiety producing, it's acoustically bad, there's lots of background noise, and many of the talkers are not doing the right things in terms of communication. So Jen has heard this story already, but it's a story about my mom in the hospital who didn't have much hearing loss, had a little hearing loss. She was going to have surgery the next day. And as often happens, the surgeon came in to talk to her when none of us were there with her. And he talked to her about the surgery. And then he left. And when I talked to her later, I said, well, what did he say? And she said, I don't know. I couldn't understand him. And I said, did you tell him that you couldn't understand him? And she said, no, I didn't want to hurt his feelings. So here's your daughter, the audiologist, kind of holding her head in her hands. And it's like he didn't know that you weren't understanding because I think she was nodding her head. But she was about to have surgery and she didn't know what it involved. So the nurse called, and he came back and was extremely apologetic for the fact that she had not understood him, which he had no idea. So tell people that you are having difficulty hearing. One of the suggestions is to make a sign to hang over your bed if you're an inpatient, but now there's usually the whiteboard where they write the day, the time, who your nurse is, and it could be up there. But the point is to inform the stream of people coming into your room. And I have been hospitalized, and it is not a good situation because you're stressed away from home and various people are coming in at all hours of the day and night. And not all of them are doing good face-to-face communication unless you tell them. Now, some hospitals will provide an assistive device to you where there's a microphone set up for the provider to talk. Not always, but that is worth considering. And I wanted to make a little plug for the Hearing Loss Association of America information. This is from their website. So the HLAA website has this huge set of information that are all resources for patients in all different situations. In the ER, as an outpatient, doctor's visits, admitted, and they actually have, even if you wanted to use one, this form that you could keep with you, and it just puts in writing what will help you while you are there for communication. I had to have an MRI recently, and I'm laying there and I'm listening, and on the other side of the room was this poor gentleman who was in the MRI, and they had taken his hearing aids, and of course he could not hear a thing, and they were trying to find the hearing aids and they were lost. And I was just like, oh, this is the worst thing because he needs his hearing aids because he's not hearing. But hospitals are difficult situations in many ways, and if you know that you are going to go into the hospital and you do want to make sure that you are hearing well, there are resources to do that. So, okay, so that brings us, I think, at about the right time for more questions or discussion.
So this was great, Dr. Souza. Thank you so much for this information. We do have some folks putting some things in the chat. What are some things you can say on how to better communicate with providers who are not native English speaking
Yeah.
and have strong accents?
Yeah, this is such a great question because a strong accent is another one of those difficulty layers that we were talking about, right? That degrades the information coming in, making you work harder to compensate. Their accent is their accent, so we can't change that, but you can get them to change many of the other things, such as speaking more slowly, facing you when they talk, reducing the background noise. Those are going to help somewhat. And I would say information in writing is so helpful. Like several people mentioned that during the icebreaker. If it's a situation that's more than a brief encounter, let's say a medical situation, you could ask to have the key pieces of information prepared for you in writing or summarized for you in writing, so you're not mistaking anything that is being said. I did want to mention there are also talk to text systems. I mean, they're often used like over the cell phone, but you can use systems that are captioned the way my voice is captioned right now. They won't be absolutely perfect, but if you were in a situation where you were communicating with someone who had a stronger accent than was easier for you to follow, and you had a smartphone, it might be worth using one of these systems, one of these live captioning systems to get more information. So yeah, it's almost like a toolkit where you have these various ideas of what might be helpful. But yeah, that is a very difficult scenario, I think, a mismatch in accent between talker and listener. Okay, so I see a question here, another good one. For folks who have used hearing aids lifelong, there is a lot of self-advocacy, which can be exhausting. What are ways we can help address that? Right, like you are always the educator because people don't get it, and you have to just keep doing it. I I wish I had a better solution than needing to do self-advocacy because I think people need to do self-advocacy. Now, I will say you're not just helping yourself, you're helping the greater communication, right? In teaching something about how to communicate with you, you're probably helping future people that you don't know. Maybe that talker will be a better communicator in several ways. But yeah, I think it is exhausting. One thing that sometimes may be possible is instead of having to do all of this one-to-one self-advocacy in the moment, if you were attending an event of some sort or a group, it might be possible for the group leader to sort of pre-distribute some of those helpful tips, right? If you're attending a class, let's say, or a lecture, instead of you having to say to the talker, do this, don't do this, maybe the group leader or the organizer would be willing to share a set of recommendations and suggestions with everyone there. So you're not the one who has to do it every single time. But I do think when it's a one-to-one conversation, it's hard to find a way around you being the one to say, it would help me if you did this. A guide or tips for leading programs and events to make them hearing friendly. Definitely. Yeah, there are lots of easy suggestions, and I don't know the best way to do this, but Kelsey, I would be happy to send that to you, or maybe send it to the site leaders or send it to Jen, like a sort of quick tips sheet that would be more hearing friendly because we can educate each other.
That would probably be great information. One of my colleagues and I put together a newsletter for our professional network. And I'd be happy to share that
Perfect.
in that
Yeah.
newsletter. So yeah, that's great.
Yeah. One of the groups I have worked a lot with around Chicago is a group called Ollie, which is a lifelong learners group, and it tends to be adults who are older taking classes for fun, on different topics. But A lot of people with hearing loss, and classrooms are really such horrible places acoustically. So again, there are some simple things that make it easier, but people do not necessarily know to do those simple things that they're needed or what they are. And they go a long way.
I have had the experience of using like the microphone for somebody who's had hearing loss in a larger education workshop, and it worked so well. And we had a longer cord on the microphone, but everybody that was in the group was so accommodating and wanting that particular individual to be able to get as much out of that experience as everyone else who didn't have as severe of a hearing difficulties. So I think it's a great idea.
And, it really reduces listening effort for everyone. So that microphone is in that catch, carry, and couple category where you're basically bringing the signal from the talker to the listener. But even if you don't have hearing loss, it makes it easier. And then you have more cognitive resources to do other things with. The Hearing Loss Association of America group that is closest to me is at a senior center, and they are absolutely consistent about making every speaker use the microphone because they should. Some speakers tend to drift. The microphone just somehow drifts away from there. And then several people in the group will say, please move the microphone closer to your mouth, right? That's how it works the best. The speaker who stands up and says, I've got a loud voice, everyone can hear me in the back. No, use the microphone. It makes a difference.
I really like this idea of us being able as individuals who are having any of those hearing changes to really take control of all that we have in front of us. And so Dr. Chin has a great, he finds it very helpful when patients or families share that information ahead of those visits. And that, there's lots of ways to do that now. But those are all really great ways to just prepare ahead of time for those really important conversations that we have to have.
And I like Kelsey's suggestion here, for the self-advocacy. So you just don't have to say it over and over again, having a card prepared where you can just hand them out. Or if you're attending a lecture or a service, then it may be easy to get that card to the speaker, and having it visually in front of them can remind them about the best ways to help.
So, Dr. Souza, I just want to thank you again. This was a really timely education program. We're in a holiday season where we have all sorts of activities that we're taking part in with friends and families that are probably in areas that are not conducive environmentally to good conversation, and all sorts of people around. And so you've given really practical tips and strategies that all of us actually can use to enjoy our time with family and friends together, and share what we need so that those times can be enjoyable and fun. So thank you very much.
Thank you so much.
Yeah. So we're gonna start wrapping up our time together. Allie, if you could share our closing slides. I want to acknowledge the work and the resources that are available at the Aging and Disability Resource Centers across Wisconsin. We have two ADRCs. We have the Alzheimer's Disease Research Center, and we have the Aging and Disability Resource Centers. And there are two very different things that happen in those two places. So if you are in need of any sort of resources or care and support services, we have a number of dementia care specialists across the state, and these are the contact informations for how you can reach them for our host site partners. But on the lower left-hand side of this slide, there's a general email or a general website, I'm sorry, where you can go and you can find the contact information for the ADRC in your county. So feel free to reach out. These services are available to you at no cost, and it's very helpful to reach out and learn about what they can do. Next slide, please. And our other partner this year has been the Madison Senior Center. And so if you are living in the Madison area and looking for an opportunity to get out and socialize and connect with people, this is one of those opportunities that you have available to you. So thank you to the Madison Senior Center. Next slide. So we, hot off the presses, we are just starting to plan for our 2025 program calendar, and we have confirmed our first speaker. So on March 14th, Dr. David Rakel will be joining us. Dr. Rakel is a family medicine practitioner through UW Health. He's faculty with the UW School of Medicine and Public Health, and he is going to be talking about integrative medicine and how that can be helpful when living with mild cognitive impairment, and all of the resources that are available with those services and supports. And so there's the link for you to, I'm so sorry, I've got a frog in my throat. There's the link for you to keep an eye on when registration will be open. We don't have all the materials ready yet, but it will be open after the new year, sometime in January, I would suspect. Next slide. Nate, do you want to share any information about recent podcasts that you've been doing with Dementia Matters? Or I know that you put a link to the one that you did on hearing loss. So
Yes. No, so for those that aren't aware, you can Google Dementia Matters, and it's a podcast that's probably about 15 to 30 minutes in duration. It comes out twice a month. And we interview researchers, clinicians, caregivers on various topics. We did interview one of the researchers of that Achieve study that Dr. Souza talked about, so Dr. Franklin. And so he has more information about the study itself there. But really, the information presented today was at that detailed level that we were hoping for interested people about hearing and cognition. But if anyone has any topic suggestions, you're welcome to email us or put them in the chat, or we have our own on the website. We have a place you can email comments to. But we're going to continue to do this into 2025. We have one more episode coming out before the end of the new year on holiday tips for people living with any form of thinking change, as well as the families of those individuals and how they can be helpful. And so that's with Dr. Alexis Eastman, who's one of my colleagues at UW Health. But we're excited to continue doing it.
great, thank you, Nate. Next slide, please. If you would like to stay connected to the Wisconsin Alzheimer's Disease Research Center, we have a monthly email newsletter subscription, and that's called Headlines. And so the link is here and in the chat for how you can subscribe to that, and any upcoming Healthy Living with MCI programs will be listed in that newsletter. And so it's another great way to stay connected to what's happening at the center. Next slide, please. If you are interested in volunteering for a study, and today we heard about a study where they needed participants to enroll, we do have a link to our webpage on volunteering for studies, where you can learn more about what is all involved in that. And then we have a way to apply right online, and we will receive that information, and then we can give you a call back. So next slide.
John, if I could add one thing there too,
Yeah.
selfish plug. If you would like to have your memory evaluated and you are interested in understanding what kind of hearing changes you have, at UW Health in our geriatric memory clinic, we are working with Dr. Souza in that study on over-the-counter hearing aids. And so it's sort of a twofer. If you come in, we will be able to do both. Not every practitioner, just not every practitioner in our group is doing this quite yet, but we are moving in that direction. And so you certainly could just ask when you're scheduling a visit, I would like to be assessed not only for my memory, but my hearing. So please put that note down, and our team would certainly try to accommodate. But it's a pretty exciting study. And at the end, for those that are eligible, you get your own set of over-the-counter hearing aids.
And I would just add for Dr. Chin, so if you already have a memory diagnosis and you're interested in the hearing part, there is also a possibility of having those tests done at UW-Madison. You know, that's another one of our test sites. So that would be for people who have finished the memory diagnosis pathway and are now looking at the hearing aspects. But yeah, they definitely go hand in hand, and we are great believers in not dealing with one and ignoring the other.
Thank you for that added information. Next slide. So we're going to hang out on this slide for just a minute because we really, really, really do want to receive your feedback on how we're doing with this education series. And so if you have a smartphone and would like to hover your camera over this QR code, you'll be taken right to the survey. And Ben has also put a link to the survey in the chat so you can get it there. And you should also be receiving, after our program ends, you should also be receiving an invitation to complete the survey that way. So we really do use your feedback to improve how we provide this program, and also it helps us to identify speakers that you'd like to hear from in future sessions. So please do that. Next slide. So this concludes, we are right at 11:30. Dr. Souza, I don't think we have had a speaker follow our agenda as firmly as you have. This was fantastic. I just want to thank you again for being part of today's program. And I want to thank everybody who's joined us today. We wish you a very happy holidays, and we hope that you'll join us again next year for the sessions that we'll have available to you then. So take care, be well, and we'll see you next year.